what we are first going to go over is seat depth. Okay? So I put these up here so you can see them too, because as we turn the page, you won't have the picture, and I'm a visual person. If I can see it, it's good. Seat depth is basically you're looking at the back of the chair, okay, to the end of the sling. You will see variations in how you measure people, okay? Oftentimes you're not measuring them in the wheelchair because they don't have the wheelchair, okay? And the parts of it gets in your way. Oftentimes you will put them on a mat, okay, or a plinth. You need them on a hard surface. You don't do this on a hospital bed or something like that because the cushion brings them down or the mattress brings them down, okay? For this first measurement, your book states, and this is going to be a great picture here, but the book states you put them in supine in a 90-90 position. So you put them in supine and you put them up on a chair or a stool, hips at 90, knees at 90, okay? And I'm measuring with just a tape measure, okay, from the most posterior aspect of my bum tissue, okay, to the back of my knee. But I do it in a straight line. I'm not curving around my tissue, okay, or my soft tissue. You just do it in a straight line and you're eyeballing where you're at. Make sense? Mm-hmm. If your person cannot get into supine though, guys, okay, you can do the exact same thing in sitting. And I'm going to show it to you kind of makeshift here so that you guys can see. So I have them sitting, get them in 90, probably put them in a back chair, and I measure them from the most posterior aspect here to the back of my knee. Make sense? Now, with that being said, okay, what you are then going to do, again, I'm a simple math person, right? Take my tape measure. Let's say it measured 30 inches. Nice and even for me, right? I then minus 2 inches. And on the sheet, you put that measurement down. So I minus 30 inches from 2 inches from the 30 inches, so it's 28 inches, and it will say seat depth and have a space, and you put 28 inches. The manufacturer will know that you already subtracted it because that's standard measurement. Do you understand? Okay? I will tell you this, some ordering forms, and what it will do is just be a form and it will say seat depth. It'll say back height. It'll say hanger angle, blah, blah, blah. And it'll just have spaces, okay? They will tell you the unit of measurement they want you to use. Most of the time it is in inches, but I have seen it in centimeters as well. Go by what they tell you. If you just say, hey, I'm in America, I'm using inches, so I don't know the metric system, and they're measuring by centimeters, they're not gonna make that adjustment for you. Okay, and then you screwed the whole thing up, and a $5,000 wheelchair is completely inappropriate now. And who has to eat it? Your company. Why do you think, as I'm measuring this, okay, as I'm sitting here, I'm going to leave this armrest off, especially since you're videotaping it, you can see it, but that I have to subtract 2 inches from the back of my bum, okay, basically to the back of my knee. Why do I take 2 inches off of it?
So you'll cut off circulation.
Too much pressure on the...
Beautiful, okay? So my knee, I hit them all, okay? So my knee can bend without being inhibited. So I don't cut off circulation or any the neurovascular bundle that's in your popliteal space can become compromised, okay? And you said pressure. If I leave it here, this end of this seat here is going to press up against the front of my knee. It's going to cause skin breakdown. Okay, so you minus that to take all that out. If it is too short, let's say for some reason I do my math wrong and I take 4 inches off, what's that going to do to me clinically? It's going to tilt me forward, okay, especially if it's really not that deep, all right? It's going to tilt me forward and it's going to put me in a posterior pelvic tilt, which makes me what kind of sitter?
Sacral.
Beautiful, Ryan. Sacral sitter. And we know what happens with that. Skin breakdown, ulcers, not good. As well as the postural deficits that come with that. I become kyphotic in my spine, you know, I then decrease my breathing capacity, blah, blah, blah. I will tell you this, when you have any type of insert, and for this measurement it will be a back insert, If it is not a cushion, it's just an insert, so it's molded to them, it doesn't give at all, you need to add that to your measurement or subtract it, whatever it is, you know. I don't care about that right now. You'll learn that later. It's not a big deal. But you need to make accommodations for inserts. I'll tell you about the cushion stuff, but you will need to make accommodations. But for this measurement, don't worry about it too much, okay? Just go off of that straight measurement. Back height. Back height goes from the seat, okay, to some point on the patient's back. All right, throw a flower. We're all good. What we're going to do here is I'm going to measure from the bottom of her seat here, okay, and I wouldn't have her in this wheelchair. I'd have her on the table, up to her inferior angle of her scapula, okay? If you do not know how to palpate that, you have to learn, okay? Get on the scapula and follow the borders all the way down. The last point, and it goes down into a point, and you can make a V basically with your web space and trap it basically, is your inferior angle of her scapula. You hit that point and that's where your measurement is. For a standard placement of back height. I will tell you this though, when I'm measuring this on her, her arms need to be at her side. If her arms are out at anything, right, our scapula moves as we go through abduction and or elevation, right? So arms need to be at the side. Very, very important. The other thing is her posture needs to be upright. See, she's correcting it already because it's going to change her position, okay? So bottom of the seat, right up to her inferior angle, that's the standard height. The reason why they do that is they feel like that's an adequate height that gives somebody adequate trunk support for posture, okay? It also allows for arm movement, okay? Because that's very important as we're propelling the wheelchair. All right, so I can get past the arm handles here and come back and propel forward, which gives me speed and gives me mobility. Okay. I have a patient who has poor postural support, okay, is unable to maintain good posture in free sitting, okay. What should I do to my back height?
Raise it.
Raise it up. If I make my back height higher, it gives me more stability. But if I have more stability, what am I doing to my mobility?
Lowering.
I'm limiting it. Okay? Because of this. If it's higher, I jam my arms back into it as I'm trying to propel the wheelchair. Okay? Does that make sense? But it's a trade-off. Now, who here has seen wheelchair athletes? You said it's a very tiny back support. If sometimes you're like, is it even there? Okay, and sometimes they just have a sling there. The reason for that is we want mobility. These guys are the ones that are going to have to generate more force, more speed with their wheels, and how we do that, we don't worry about their trunk support. These guys are the ones that are your really low-level paras, okay, have good trunk control, all right, and we want speed, okay? Get rid of the back and change our camber angle, which allows them to move over, you know, they turn on a dime, as they say, right? All right, and they're able to propel faster. Rear seat to floor, I'm not even going to go into that. That's not anything big. Don't worry about that. Hanger angle. Hanger angle, okay, and none of these do it, is basically the angle at which you put the footrest, all right? I don't know why they call it a hanger. It has to be some allusion to a plane or something like that, but it's the angle of the footrest, okay? The reason why we do this is number one, comfort. Sometimes with people who are sitting for a long time in that dependent position, they get during congestive heart failure, things like that, they'll get dependent swelling. If I can move their legs up, okay, that will help venous return. If I have fractured my femur, I'm in a long leg cast, I can't bend my knee, I move the hanger angle, I make it all the way up, okay? If I have a tighter or a smaller hanger angle, okay, and it's fixed, it allows me to turn, okay, in a smaller radius. This makes sense. If it's further out here, I'm going to bump into things. this, be at least 2 inches to clear the floor. So that's why you will rarely ever see the foot plates at perpendicular to the ground, because they don't have that foot clearance. And it's not really the foot clearance, it's if something's on the ground, they run and then they tip. Okay? That's the big thing. How you measure, okay, how you measure leg or leg rest kind of height here is you measure them with their, and it's right here, all right? You measure them with their shoes on, all right? And you'll measure from the sole of their shoe right to the top of their knee, back of their knee. Okay? And then they'll make adjustments based on the angle. Good? All right. Seat width, another big one. Seat width, all right? Again, we measure it sitting, usually. Actually, most references say sitting or supine. It's how big are you across? Okay, you take it from the widest point of the person, and it typically tends to be right at your greater trochs. Okay, is where, especially women, that's where a lot of us kind of hold our weight. Okay, but that's our widest part of us. It's not our waist or anything like that. So you take it here. All right, you take it from the widest part and you measure it. Okay, when you do that, you then add, okay, 2 inches. So if the widest part of me is 30 inches, I add 2. It's essentially an inch for either side. The reason why I'm doing that is to give clearance, okay, for clothing issues and things like that. They will say if you live, and I don't think this is a big thing, but it's in your book. If you live in a very cold environment and it's cold year round, you can add 3 inches because of a big bulky jacket or something like that. Okay? Now, talk to me clinically. If my seat width is too wide, what's going to happen?
You're going to laterally rotate to get to the armrests.
Yeah, I'm going to slip side to side.
And
My
harder
posture.
leverage to propel yourself.
Yeah, I might be out here. I mean, hopefully you're not that far out, okay? But most of it's a postural thing and a sitting thing, so you'll fall to one side or the other, okay? If it is too narrow, you essentially should be able to get 2 fingers in. If it is too narrow, what's going to happen?
Skin breakdown.
Skin breakdown. It's going to be uncomfortable, skin breakdown. So again, those people that gain a lot of weight sometimes have to go up a wheelchair just because, unfortunately, of weight gain and things like that, which can happen from being sedentary. Okay? Wheel camber angle, I alluded to this. Most wheels on standard wheelchairs, and this is not really an issue with any, we don't do this on our measurements, they're perpendicular. They're straight vertical, okay? But as you have said with wheelchair athletes, you'll see that they're angled in. Okay, so the top is angled in where the bottom. Anybody who's big with cars, I've said this with all 3 groups. I had a student that was huge into cars. He said, I do that with my cars. He had sports cars, and he angled the wheels in at the top, and it makes your turning radius less. So he could spin around and just turn on a dime, as they say. Same thing with these guys. It enhances your turning ability. Okay, I will say for a standard wheelchair, you don't change that. Okay. The front seat to floor is really we're again measuring that foot rest thing, so I'm going to bypass that. This is the last big thing that we need to know is our armrest height. Okay, this is big, I think. This 90, I'll do it over here first. 90, my arms are at 90. I'm on a hard surface. I measure from, the surface, the hard surface, to my olecranon. And I need to make sure that my arm is at 90 and I am in good sitting posture. If I'm forward, what's it going to do? It's going to actually make my armrest too low. Because eventually I'm going to be wanting to be up here, okay? Good sitting posture. If you have to put them in a back chair, you do that. Okay? So from the seat to the olecranon with your arm at 90. Clinically, quickly, if, like I said, my arm rests are too low, what's going to happen to me?
You're going to slump down to.
I'm going to try to slump down to reach them, right? Because it's comfortable, right? So that's going to put me kyphotic. It's going to put me in a really poor posture. It's going to affect my breathing capacity, all of that. The other thing that it will do is if that gets uncomfortable, a person will sit back and attempt to get their arms, and they can get traction in kind of issues. Okay? And that's uncomfortable. If my arm rests are too high, I do this. It's not good for anything. I get muscle tissue shortening, okay, which will affect movement patterns, okay, range of motion. These are my accessory muscles for breathing. I'm going to inhibit those, okay? So we're going to run into a lot of soft tissue issues, okay? Your big ones, I will say for your wheelchair assessment, I'm not saying that any of these are not big, but for your standard wheelchair assessment is your seat depth, your back height, you know, where do you want your leg rest to be are kind of important, okay? And your arm rests. Those are huge, okay? Oh, for arm rest, for a cushion, you guys know that sometimes your patients will be given a cushion to sit on for pressure relief and things like that. You'll learn about this in another class. Cushions typically, standard cushions are about 2 inches, okay, typically, all right? When you sit on them, they compress about 1 inch. If I'm doing arm rests and that person has a cushion in, we have to add 1 inch to my measurement because it puts me up. It raises me up, okay? So I don't add the 2 inches because I'm getting compression of that cushion. I just add the inch, and that's acceptable. It's standard. Usually, most cushions are ROHOs or variations there off of that, and it's acceptable. Okay, but that's a big compensation that you should know about.